So first is your latissimus dorsi. That's a very thin layer of muscle like trapezius in the upper back and the neck. So here this is your latissimus dorsi. So if you are removing that, the next muscles have to be coming is your erector spinae group of muscles. So erector spinae group of muscles are basically three muscles. So most medially and little deeper is your multifidus, and then comes longissimus, and then comes iliocostalis. So this is longissimus. I'm removing it, and then we will be able to see the multifidus. This is your iliocostalis. So I'm removing that, and then multifidus. I'm removing that too. So these three group of muscles are together is your erector spinae group of muscles. And then I'm just removing this, so that visibility will be better. The abdominal muscles, so external oblique, internal oblique, and the transversus abdominis. And then if you are removing all those things, then hot muscles we can see, which is starting taking the origin from the tip of the transverse process is your quadratus lumbar. This is one very important. And then anterior to that is your, if I'm removing that, anterior to that is your the psoas muscle. And another important muscles is your these two muscles. This is between the two transverse process is your intertransverse laterals, and another small piece of muscle between the two articular process of this facet joint is your intertransverse medials. So you'll be able to see all those muscles, and of course the psoas muscles. This was prepared by Kanchan. So this lateral most part is your mammillary process. So we'll be discussing it when we'll be scanning it. We'll be showing this lateral most part is the most projected part. If you are looking about this whole of this articular process, the lateral process is your mammillary process, and there is another small process here which is called the accessory process. So and there is a ligament. I'll be coming to that mammillary accessory ligament under which the medial branch actually runs, and other part lamina, inferior articular process, spinous process. You all know that. So if you are looking from the lateral view, then vertebral body, the transverse process you can see it's small. This whole is your superior articular process. This projection is your mammillary process. So when we'll be putting it, when we'll be scanning from lateral to medial, so the first time we'll be able to see the elevated part will be your mammillary process. And this projection is your accessory process. And other part, as I told you, you all know that. And now to go into the the epidural space, we are having different window, acoustic window. So the one important acoustic window is between the two spinous process here, through which we all are giving, the spinal epidural. But another important, which is particularly when we are thinking of doing it under the ultrasound or even under the CM also, this gap is basically in the lumbar area is a very big gap. So this area, this window, so basically it's the space room, and through different window you can peep it, and we can having the when we are putting the ultrasound probe, so the acoustic window. So this is one acoustic window, this is one another in interlaminar area. The foramen, intervertebral foramen. This is again one of the very important for doing under the CM, but as well as when you're doing under the ultrasound also, we can go through the foramen and we can give the drugs, the epidural drugs. Another acoustic window is described through the disc. If we are going laterally, or when we are holding the probe laterally or anteriorly, through the disc also, we can see some of the structures within the spine. So these are the different acoustic windows with which we can look, we can peep into the spine. So now some of the ligaments. One is your supraspinous ligament. Already Kanchan has shown in the thoracic area, same supraspinous, and then is your interspinous ligament. Supraspinous ligament is always very nicely seen in the lumbar area because the spinous processes are crowded. Interspinous ligament is better seen in the thoracic area than in the lumbar area. Lumbar area, the fibers are obliquely running, and that is the reason why it will be having we cannot see it nicely because it do not fall it perpendicularly. So it looks like a hyperechoic or anechoic structures. Another is your ligamentum flavum. Again, ligamentum flavum can be seen very nicely when we are peeping through the interlaminar space. And another ligament which is not seen always most of the times nicely is what I was talking about, your mammallo-accessory ligament. Mammallo-accessory ligament, this is the mammillary process I was talking. This is the accessory, and This is the mammilo-axillary ligament, and through which the medial branch runs. This is important because many of the times when you are doing the radiofrequency procedures, we do not able to stimulate the nerves nicely, particularly in the elderly, because calcification of this ligament is very common. When there is a calcification, then under the ultrasound you can recognize it, but otherwise in the normal person, because of its position, the ligament is not always visualized nicely. But the vessels and sometimes the nerves can be visualized. Then another important structures which you can see under the ultrasound is your intertransverse tissue complex, or in short we also call the ITC, intertransverse tissue complex, or we also call it intertransverse complex. So what is there in the intertransverse complex? So this muscles, intertransverse muscles. This is intertransverse lateralis muscles. Intertransverse medialis muscle is here between the two articular process, and along with that there is intertransverse ligament. So these together form the intertransverse tissue complex, and just below that is the area foraminal, the neurovascular bundle, and just below that there will be psoas. So these structures, when we'll be putting our probe there over the transverse process, we'll be able to identify these structures, intertransverse tissue complex, and then neurovascular bundle, and then we'll be seeing the psoas major muscles. So this is an MRI, just to have a little bit of orientation how the different muscles are placed there. So if you're looking from the back, so this medial most, or also called the medial tract of the erector spinae muscles. So this is the most medially and little bit under the cover of the longissimus muscles. So this is your longissimus muscles, and this part, this is longissimus and the iliocostalis together is called the lateral tract of the erector spinae muscles. Sometimes it is difficult to distinguish these two muscles, sometimes it is easy, so that we can able to, in some patients, we will be trying to identify these two separately, longissimus and the iliocostalis. So these are the three erector spinae group of muscles, and putting this is your transverse process in this view. So just in front of that, if you are giving, that is your erector spinae block. Erector spinae block can be done in the thoracic area as well as in the lumbar area. And then here, the tip of the transverse process, the quadratus lumborum muscle starts. So the quadratus lumborum muscle starts from the tip of the transverse process, and it runs between the two facial planes. So anterior to the quadratus is the thoracolumbar fossa. Basically, it is having the three part. One part is anterior, that starts from the tip of the transverse process, and it encloses is the anterior border of the quadratus lumborum. Another part is your middle part, which goes to the posterior level of the quadratus lumborum, and then again after combining with the quadratus lumborum, from there the other abdominal muscles are taking origin, and the posterior boundary is here. That is the posterior layer of the thoracolumbar fossa. So thoracolumbar fossa, basically the three layers. The anterior and the middle layer is the quadratus lumborum, and the middle and the posterior layer is your erector spinae. And anterior to that is your psoas muscles. So we'll be able to see all those structures and the different foraminal structures and neurovascular bundle. The nerves after coming out, it is getting divided into the ventral, dorsal, rami communicants, and it is accompanied by the vessels. We'll be able to identify those. So now let us see the probe positions. So both we are using the curvilinear probe as well as the linear probe, and we'll be seeing these three. The lateral decubitus. Lateral decubitus, some structures are best seen in the lateral decubitus. Sitting, we will not be doing it. Most of the pain physicians, we are not doing the sitting positions. Sitting position sometimes gives a better view, particularly when you are doing the neuroaxial block, because it separates the two lamina, and it is easier to go for the epidural procedures. So for the epidurals, sitting posture might be better, but for the pain physicians, we mostly prefer the prone positions to do our procedures. And the position of the probe, so back when you're doing, so these are the three important. One is median sagittal view. We are putting exactly on the midline. What we'll be able to see there? We'll be able to see the spinous process and the supraspinous and the interspinous ligaments. Then we'll be able to see the paramedian sagittal. Paramedian sagittal will be able to see the laminar view, and paramedian sagittal oblique, where we'll be able to see nicely the interlaminar space. And also we'll be seeing the transverse axis view, where one will be putting over the spinous process and another when you are putting it in between the two spinous process. And apart from that, not exactly in the midline, we will be going little bit lateral to that midline, we'll be able to see the other structures as well. So identification of the structures and all these things we'll be demonstrating it. but still just a quick recapitulation. When you are starting from the lateral most part and then going medially, we'll be able to see this transverse process. So the transverse process, tip of the transverse process, and which will be showing the having the acoustic shadow, and it will be having like a finger-like projections, or also called the trident view. So above that, it will be your erectospinae muscles. Then we'll be having the transverse process. In the between the transverse process, you can see the two hyperechoic line. So this is your intertransverse tissue complex, where there will be your muscles as well as the ligament. Just below that, here it is seen very nicely. This is the neurovascular bundles. Neurovascular bundle, and then what will happen? The anterior branches, they'll be going into the psoas, and they will form the lumbar plexus. So lumbar plexus also will be seen very nicely, and then the lumbar plexus, actually it lies between the posterior 1/3 and the anterior 2/3 of the psoas muscles, and that we will be able to track those lumbar plexus muscles. And I'll be also showing, though as a pain physician we are not doing the lumbar plexus work, but still we'll be showing you how and from where to be the needle trajectory when you're doing the lumbar plexus work. Then comes the articular pillar view, but before that there is another. Here it is over the facet joint, but when we are moving little bit laterally over this mammillary process, so that is another view. And if we are talking about the depth, the mammillary process is the most superficial, and after that we'll be able to see the articular process. So when you're over the articular process, we'll be able to see this, also called the camel hump. So it looks like that. So these are the basically over the facet joints, but this is not the proper way to do the facet joint. Facet joint is better done under the the cross sectional. And then when we are going into the interlaminar space, parasagittal oblique, we'll be able to see these structures, laminar view, and then your parasagittal oblique. This is also called the horse-head view. This is the horse-head view. These are the lamina, and again these are the erectospinae muscles. And then we will be able to identify the posterior complex. Posterior complex consists of ligamentum flavum posteriorly and the posterior dura. So these together is called the posterior complex. Then we'll be seeing the anechoic or hypoechoic interthecal space, and then we'll be able to see the anterior complex. Anterior complex have to be there. There will be dura, the posterior longitudinal ligament, and the posterior longitudinal ligament, and the vertebral body. Vertebral body will be obviously will be showing the hyperechoic, the rightly hyperechoic structures. So we'll be showing these structures as well, though I'll be quickly going through those things, focusing more on the advanced level topics. This is again how to count it, and that is again very easy. Mostly it is done by the parasagittal view, or you'll be seeing the sacrum continuously, and then when the first break will be coming, that is L5S1. But again, it might be misleading sometimes, because if there is a lumbarization or sacralization, then again this might not be a whole group. And that is the reason why, to identify the level, it is always better to have an X-ray. And again, the lumbar spine procedures are better done in the hybrid technique. Whatever you are doing, the levels and other things, we must be confirming with the X-ray as well, to understand that we are doing at the proper level and the proper areas. So what videos I'll be showing you at the end of this class will be showing you by hybrid technique, with which we did the facet joint injection and the transforaminal injection. So the spinous process view again, and the other ligaments, supraspinous ligament and infraspinous. Supraspinous ligament is basically the continuation of the posterior most layer of the thoracolumbar facet. So counting the level midline also. So suddenly we'll be getting the break, and that will be L5S1 mostly. Transverse process view. So this is again very important. The transverse, if we will be able to see the spinous process, and we'll be able to see the lamina, and then we'll be able to see the transverse process. So the 3 steps: 1 step, 2nd step, 3rd step. And in this step, in this corner, we'll be able to identify the facet joint as well. This is the area when we are holding it exactly over the spinous process. But if we are in between the two transverse process, then what we'll be able to see here, when the probe is here, then we'll be able to see the interthecal structures, the posterior complex, the anterior complex, and also facet joints in a better view when we are in between the two transverse process. So again, we'll be showing that things. And this one is a foraminal view. I'll be explaining it when we'll be showing the volunteers. So there, what will happen when we'll be scanning from lateral to the medial, suddenly we will be seeing that the hyperechoic, most superficial structure, this is a mammillary process. And then what we will do, we will be keeping the caudal end of the probe fixed, and the cranial end of the probe will be going laterally, so that again will be going down to see the transverse process. So now the probe, one side of the probe which is elevated will be over the mammillary process, another side of the probe will be over the transverse process, and we will be able to see the foramen. So first we'll be taking a curvilinear probe. As I told you, most of the scanning will be done by the curvilinear probe, but sometimes we'll be taking the linear probe as well. We'll start scanning from this area, and we'll be coming over the transverse process, and then we'll be seeing the finger-like projection or trident view. And then this most elevated projection is your mammillary process, then we'll be coming over the mammillary process. And then we'll be going little bit more medially, then we'll be seeing this articular view, camel hump view. And then we'll be going to your lamina, and then parasagittal oblique, where we'll be seeing this window through which we can see the interthecal space. And then over the midline. The midline by the spinous process is a very superficial structure, so that is better seen by the linear probe. So this will be going like this, and then when we'll be going like this over the transverse process, over the spinous process, then we'll be able to see the 3 steps. First step is your spinous process, next step is your lamina, and then third step is your transverse process. And then when we'll be in between the two spinous process, we'll be able to see the facet joints better, and we'll be also able to see the interthecal structures. So this will be when the patient is in the prone position. But again, when the patient will be taking the patient in the lateral view, and we'll be seeing over the transverse process, and we'll be able to see the muscles and the foramens nicely in that view as well. So now let us start scanning. So my aspect marker is cranially. That means on the screen, the left side is the cranial side, and the right side is your caudal side. So what you can see here, we can see the finger-like projections, and that is your transverse process view. So this is your transverse process. This is another transverse process. So these muscles are erector spinae muscles, and here you can see this hyperechoic line. This area is your intertransverse tissue complex. So intertransverse tissue complex, after that this area there will be the nerves neurovascular bundle, and then the psoas muscle starts, and in between the psoas muscles this plane is basically the lumbar plexus plane. The lumbar plexus plane, what I was already talking, that if you are whole depth of the psoas muscle, anterior 2/3 and posterior 1/3, where the ventral rami of the nerve roots, they form the plexus. So now, if we are at this view, from this view, if we are going more laterally, then just look at this. What happens? Now the transverse processes are gradually disappearing, and now we try to understand some hyperechoic glistening line is appearing between the two transverse processes, and follow that. I am going laterally. So at this point, this is your thoracolumbar fascia. Still it is now anterior layer and the middle layer together. So this part of the muscle is your erector spinae muscles, and this muscle is your psoas muscle. Psoas muscle depth is here, bulk is here maximum. So the two muscle layer, erector spinae group of muscles and the psoas group of muscles, and they are divided by the anterior and the middle layers of the thoracolumbar fascia. So from there, if I am coming more laterally, so I was here, and now you can see this thoracolumbar fascia. You can see the psoas muscles. Above that is your most superficial is your erector spinae muscles, and you can see the the moving. And I am going with the respirations. I am going more laterally, and now see the two thoracolumbar fascia layer is now starts separating. And if I am going more laterally, you see the two hyperechoic line, glistening line is very nicely seen. and in between is your quadratus. So you see here, so now three muscles we can see. One is this is your ilium bone where the thoracolumbar fascia is attached. This is another layer, this is another layer. So this is your erector spinae muscles, this is your QL, quadratus lumborum, and this is your psoas. So now at this level we can see the erector spinae. So these three muscles very nicely, when we are starting at this point, if I am coming laterally, just follow this, the quadratus muscles very nicely. And now you see the psoas muscles depth is now reducing. You see here the psoas muscle was very deep, very broad, and now gradually the quadratus depth thickness is increasing and the psoas thickness is gradually decreasing. And if you are going more laterally, then the quadratus, QL, the two thoracolumbar fascia, now here you see the psoas has disappeared. Now here you see, this is your psoas, this is your erector spinae, this is quadratus lumborum, and this is your psoas. Now let us scan medially. So this was the transverse process. Here we was there, and here we can see the intertransverse complex very nicely. Just below that we can see the neurovascular bundle, and after that we are having the psoas, and within the psoas we can also see the lumbar plexus forming. Now the intertransverse complex is very nicely seen. So this is your intertransverse complex. Just below that is your the neurovascular bundle, and from here is the psoas, and this is your neurovascular, the lumbar plexus within the substance of the psoas. So now we are going more medially, and now this is the mammillary process. This is the mammillary process. So mammillary process is the most projection. So if you are when you are coming scanning from lateral to medial, the most projected part is your mammillary process, and that here this was your accessory process. I was talking about the mammillary accessory ligaments. This is accessory process, this is the mammillary process. So when you are scanning it, we can see the transverse process, and suddenly it is elevated, and that is the accessory process. And there is also another muscle. You can see that muscle is this muscle is the intertransverse medialis muscle. As I told, intertransverse lateralis muscle was there. This was the intertransverse lateralis muscles in between the two transverse process. And when we are going here in the mammillary process, we can see another muscle here, intertransverse medialis muscle. Now at this point, now follow this very nicely. When we are going little more medial, then comes your camel's hump. So this is your camel hump or articular process. Articular process too, facet joint. Here it is your sacrum. So now again from here, just follow me. This was your anterior middle layer of the thoracolumbar fossa, quadratus, and then your transverse process. Now we are going medially. Now you just follow this. Suddenly, you see, now the mammillary process has started appearing. You see, now the mammillary process we can see very nicely. And here we can see the foramen and disc. So you see, this is the foramen, and this shadow, how we can see, is your disc. If you are looking about here, again, can you focus it here? So if you see, when our probe is here, in between the two mammillary process, if we are tilting a little bit, we can see the foramen here. So that is one of the way to do the transforaminal epidural. That means here, again, see the transverse process. When you are moving medially, suddenly this, the hyperechoic line starts appearing and transverse process is disappearing. So this is the mammillary process. Here in this view, we can see the neurovascular bundle, and if you are making a little bit of medial tilt, then we'll be able to see it better. But here we are having our own technique, what we are doing it. I'll be showing the video also. At this point, what we do, that one caudal end, I'll be keeping it over the mammillary process below, and above I'll be tilting and I'll be going back into the. So here you see, this is your articular process and this is below, depth is below. This is your transverse process view. And here you can see this is your nerves, the vessels anterior to the nerves, and the acoustic side is acoustic window through which we can see the disc as well. So here we can do the transforaminal epidural in plane technique in this angle. So if we are going in this area, this is called subpedicular approach, and if we are doing it here, this is called Campbell's triangle approach. So through this way, we can go over the pedicle and the junction of the superiorticular process and the transverse process. That means over the pedicle, and you can come here and you can inject the local anesthetic and whatever we wish to do this here. So this is one of the in-plane technique through which we can do the transforaminal epidural. So you understand, these are the two important structures. One is your articular process, this is your transverse process. Again, I am showing you, just follow it. So I am going here, the transverse process view, and suddenly what is happening? We are seeing the mammillary process, and here what we are doing, we are keeping the caudal end of the probe over that mammillary process and going back to the transverse process view in this. So one height is superior and one is and here you can see the pulsations, very nice pulsations there in the foramen, and very bright hyperechoic nerves also you can see there. You can see the blood vessels, and this is the area where it is the disc, and this is your nerve, hyperechoic structure is your nerve. And the acoustic ultrasound beam is going down into your disc. So now at this point, if you are going a little bit more medially, this is called horse-head view. So at this point, the picture is changing. We cannot see nicely the interthecal space, but if at this point, if I'm tilting this probe, and now we can see let me reduce the depth a little bit, then you can see it better. Okay, so we can see the structures very nicely. So this is what is this? This is your ligamentum flavum, and this is your posterior dura, and this is your anterior dura. This is your posterior longitudinal ligament and the vertebral body, and this is your intrathecal space. Okay, so this structure is very familiar. Those who are doing the ultrasound guided or assisted, the epidural injections, so they are very familiar with this view. And then if you are coming more medially, then you can see the spinous process. So spinous process is as I was telling, so this is the spinous process. It is better seen with your linear probe. Now I'll be coming into this short axis view, transverse. So as I was telling, there will be two view important. One is over the transverse process. When I'm over the spinous process, then we cannot see anything there. And here we'll be able to see the 3 steps. So what you can see here, so this is your spinous process, this is your lamina, and this is your transverse process. So at this we cannot see the interthecal space because we are over the transverse process. Now, if we are going in between the two transverse fosses, then this view, what do you call? This is also called bat's view. So it looks like a bat, flying bat. So this is your lamina. This is your articular process pillar. This is your facet joint. You can see this facet joint. And this is your posterior complex. This is your ligamentum flavum. This is the dura. Again, this is your dura, and this is your. So this together is your anterior complex. This together is your posterior complex. So now, what I'll be doing it. I'm not concentrating much on these things because these are all in the basic course. Now I'll be going to show you how to go for the intra-articular facet joint injection. So intra-articular facet joint, I'm coming little bit of laterally, and I'm just going. You can see this is your facet joint. Let me show you the good view of the facet joint. Okay, so this is your facet joint. This is your facet joint. Very nice, listen. This is your facet joint. So this is your, one articular process. This is another articular process. This is the transverse process. So the facet joint. And medial branch block, we have to concentrate on on the junction of the superior articular process and the transverse process. So I'm just trying to focus it. As I was telling, many a times we cannot see the mammario-accessory ligament under which these vessels and the nerve runs, but most of the time we are able to see the pulses in there. Okay, okay, can you see the pulsations there? So pulsation is seen there. So that is where we have to go for the medial branch block. And now, if you are going more laterally from here, in this axis also, you can see all the last muscles very nicely. So let me explain. So all the erector spiny group of muscles. So here was the transverse process. And from here you can see this is your middle layer of the thoracolumbar fascia. This is the anterior layer of the thoracolumbar fascia. So what is this muscle? This is your QL. What is these muscles? It is under the transverse process, so you cannot see the whole of the muscles. But you can see this part of the muscles. This is your psoas. And here you can see the three muscles very nicely. This is your multifidus. This is your longissimus. And this is your iliocostalis. So these three muscles are very nicely set. So suppose if you wish to go for the quadratus, either you can come like this or you can come like this to do the injections in the quadratus. Or if you wish to do the facial plane block, that means as I was telling, many of the myofascial pain nowadays we are preferring to go for the myofascial plane injection, 5% dextrose. So in that situation, we can go injections here between the psoas and the quadratus. Now I'll be taking the patient in the lateral decubitus. My aspect marker is on the left side, that means dorsal side. First look at this view. So what you can see the aortic pulsation also. Now you see what are seen here. So this is your transverse process. This is your vertebral body. This is your aortic pulsation. And this is your articular process, and then it comes the spinous process. So what you can see here, these muscles already you have seen, this muscle is your QL. This is your erector spiny, and this is your psoas front. And here you see this, if you wish to do the lumbar plexus block, as I was telling, this lumbar plexus is formed here in the fascial plane here. So lumbar plexus will be gradually, the nerves will be coming here and then it will be going anteriorly. So at this view, If you wish to do the lumbar, here I cannot go because here the transverse process will be obstructing. I'll be showing you this plane again. But this picture is very important, that spinous process, the transverse process, above that QL, posteriorly is erectospiny, anteriorly is your psoas. So remember this picture very nicely. Okay. So you see very nicely the psoas, the quadratus, the erectospiny, and you can very nicely see the lumbar plexus there. So now, if I am moving the probe, I am moving the probe superiorly and inferiorly. See, transverse process will be vanishing. Transverse process is vanishing. You see, transverse process is vanishing, and what you can see here is the neural foramen. We are at the level, disc level, and you can see here. What you can see. So what you can see the pulsation there. So these are the foraminal vessels. And at this level, you can see the nerves which are coming down and forming the lumbar plexus there. So this is the foramen. This is at the level of the disc. Why? Because the shadow is going down. And you can see the foramen very nicely. So to study the foramen, you see the pulsations there in the foramen. You can see this is the spinal canal. And you can see it is going through this ultrasound beam is going through the disc, and you can see the foramen. So this is another way you can come from posteriorly, and you can come here and inject into the foramen, and you can see nicely the nerve are going, ventral rama is going, and if you wish to do the lumbar plexus block, so here this is your target. This is whole is your psoas muscle within which we can see the lumbar plexus there. And another very important procedure under the ultrasound, very easier. Let me see it here. So where is the lumbar sympathetic nerves are there? It is in the, so this was your vertebral body. This is the aorta, and lumbar. If you wish to do the lumbar sympathetic block, you need to come here. So how we can do here? We can come like this, and you can do the lumbar sympathetic. And another procedure is there. At the same view, we can do that. Is your rami communicants block. Rami communicants, where it is? It is here, vertebral body, middle of the vertebral body, and there needle comes like this. So these are the two other procedures which can be done at this position. Apart from that, I was showing here is a foramen. So you can think of doing the foraminal injection, though we have not doing this foraminal injection in this view, in this way, but that is a option to come into the foramen. So again, let me show this quickly, and then again, so you see this view, transverse process. Annotation clear. So this is your transverse process, then your vertebral body, aorta, very nice vertebral body. If I am just moving below, now the foramens appears. So in the foramen, you can see the pulsating vessels, you can see the nerves, and you can see these nerves are, if I am going above and below, you can see the connection. You can see this is the lumbar plexus. So it is coming, if I am moving it, you just follow this. You'll be able to see that the nerves from the foramen, see this is the foramen very nicely seen, and you can see the connections there. You see? So now it is how it is forming the lumbar plexus. So you can see that these nerve roots are coming, and here it is, transverse process is appearing. So this is your, what I was telling, this is your target if you are planning to do the lumbar plexus block. Okay, so that's all. Sir, this was prepared by Kanchan and